Now we're going to be joined by our final presenter who is here with us now. So, Soraia, is that
Yeah.
Soraia D. Camargo Catapan is going to talk to us about telehealth and digital healthcare, clinical effectiveness, and consumer trust in practice.
Hi, everyone. Thank you for inviting me for being here today. I apologize in advance that my voice is a bit weird. I'm sick at the moment, but I told Rachel I really wanted to be here because I know how important it is, this event. And I think it's also, super important to talk about telehealth and this, way of providing care specifically for this group and these conditions. So, um, as Julie said, my name is Soraia, and I am a research fellow and a lecturer at the Center for Online Health at the University of Queensland. And I'll be talking today about telehealth, which is, the main body of my research, and also about something about digital healthcare. And I'm going to be comparing some of the modalities, and talking about clinical effectiveness and consumers' trust. But before I begin, I would like to acknowledge the traditional owners and the custodianships of the lands in which we meet today. I'm dialing from the lands of Turbo and Niagara people. And I also pay my respects to the ancestors and the descendants and those who continue cultural and spiritual connections to country. Right. So Rachel gave me a list of things she wanted me to talk about. I will try to cover everything. I might be a little bit quick in some of them, but I'm happy to answer any questions, throughout the presentation and but also at the end. So a bit about myself. I'm a pharmacist by background. I have MPhil and a PhD in public health, and I did all my training in Brazil. That's where my accent comes from. At the moment, I teach seven undergrad and postgrad courses in telehealth and digital health at UQ. The main body of my postdoc was around trust and confidence in digital health and telehealth from consumers and healthcare professionals' perspectives. Um, at the moment, I'm working as well in a digital nutrition model of care to improve chronic kidney disease management in Northern Australia. It's in partnership with Yarrabah community. I also have still some international collaborations with Brazil around e-consults and the role of the digital navigator to help people to better navigate health systems. And I have other telehealth projects as well around clinicians' capabilities to conduct telehealth, um, how to implement interpreter services for CALD or cultural and linguistic diverse consumers. And but the main, I would not say the main, but the best or the part that I enjoy the most about my work, it is the telehealth consumer reference group. So that's how I met Rachel, and that's how I've been invited to be here today. So this group started back in 2022. Um, it was when we had a tiny little bit of money to put something we've been dreaming about for a while into reality. So we got this money. We sat down, between the researchers at the Center for Online Health, and we said we need to bring some consumers, to talk to us about what we need to research. What is the priority? What would they like to see in research to bring them to be partners to co-design and to do all this amazing work we've been doing since. So we started recruiting consumers online, basically, and we were looking for people passionate about telehealth and wanting to advocate for this modality of care. So now, so we launched an expression of interest. We had 33 consumers who signed up. We then did a lot of intro sessions to get to know each other, to align expectations. We voted for a new group name. And nowadays we have more than 40 consumers across Australia. They come from different backgrounds. They have different conditions. They have different preferences as well. And we try to, make them feel comfortable and to participate in the best way that they can. So we normally do hybrid events, so we do events which are online, in person, and we try always to have people to participate in the best way that they can. Um, I did bring some pictures, yes, from some of the projects we've been doing in 2024. So here on the left-hand side, we have a slide, a Zoom screenshot when we were planning a consumer involvement in research workshop for the successes and failures of telehealth conference, which happened last year. We've been developing some testimonial videos. We involved consumers in grant applications, in developing projects with us, project ideas from scratch as well. We had last year as well a meet and greet event with consumers. And important to mention that the recruitment of these consumers is ongoing. So if anyone wants to participate, to enroll and to be part of this amazing group, just get in touch and we'll be happy to send you an expression of interest for you to fill in and to book intro session with you to get to know you a little bit more and to introduce ourselves as well. I was going to play a video, but I'm not going to play this video. I'm going to leave you with curiosity. You can log in into YouTube to watch this video. I can, if I can find you all here, maybe I can even put the link in the chat. I just need to find the chat. Bear with me. Maybe I leave for later, but I can put the link for you later. Or you can scan the QR code if you want. So this video, we talk a little bit about why telehealth is important. So instead of me talking to you why telehealth is important, I leave you to watch this 2-minute video on YouTube, and you can learn from consumers from our group why they think telehealth is important. Instead, I'm just going to focus a little bit on the evidence. What is the latest evidence on the telehealth modalities? And when we talk about telehealth, it's important to clarify what we're talking about. There has been a lot of disagreement internationally in the scientific community around what is telehealth. So here we have a graph which shows the differences between what is digital health and what is telehealth. So if we think about digital health, that's kind of an umbrella term, which is a little bit broader than telehealth. So everything that has big data, AI, electronic medical records, my health records, wearable devices, robotics, all of that is under the umbrella term of digital health. And then when we talk about telehealth, we're talking a bit more about telecare, we're talking about telemedicine, virtual care. These are similar terms as well. And we have different modalities of telehealth. So we have teleeducation, telediagnosis, which have different names as well, which doesn't help, teledermatology, telecardiology, teleradiology. So that doesn't help. But these are services that have been specialized in telehealth. We have electronic consultations, which is when the primary care clinician reaches the specialist for advice. We have telehealth appointments, which are in yellow here. This is the modalities I will be talking about today. But this is just to show you that there is way more than when we look at the terminology telehealth, there is way more than only telehealth appointments. And then if we look what has happened in Australia in the last 5 years, there has been a massive shift. This information here in this beautiful infographic is available on the Center for Online Health website. You can use the QR code here. I can share the slides as well if you want. But the Medicare benefits schedule, which is a list of items that includes the fees for medical services by the government for eligible treatment, show that the uptake that has happened in Australia for telehealth has been massive. Whereas before COVID, we had only 20 telehealth items in the MBS, 20 telehealth item numbers. After COVID, we had more than 5,700 new items implemented because of COVID. So we remember that we were isolated, we were at home, and we needed some new telehealth items in Australia. And that was from, it was super quick that has happened. But then what has really happened, and we can see here, is that instead of people using more the video, that's the modality that's more used, for example, in the US or in Canada or in Brazil, in Australia, people started to use way more the telephone. So we have nowadays, as you can see, 86% of all the NBS telehealth data is done by phone, whereas only 14% is done by video. And we know there are differences between these two modalities, and this is what I want to discuss a little bit more. You can see at the bottom here of this infographic as well, the increase that we had from 2019 to 2020 when the pandemic hit. And then 2022, 2021, we still had an increase, but then we had a slightly decrease. And we're going to be talking a little bit why, the reasons why we think, or the research shows that this decrease has happened as well. And these graphs also show on the left-hand side here, we have nurse practitioner consults, GP consults, and then on the right-hand side, we have mental health and psychiatrist consults. And we have here a year analysis of since 2019. Purple is in-person consultations, gray is telephone consults, and red is the video consults. So we can see here that primary care usually uses more the phone, as research has shown, and mental health and psychiatry consults use a little bit more proportionally the video when we look in telehealth modalities. Of course, all the specialties and primary care specialties as well, we use more in-person consults, which is still the gold standard, or considered the gold standard. But then when we talk about telehealth, what is the most effective modality? So we were asking this question, after COVID and after we saw that surge in telephone appointments in Australia. And we did, at the Center for Online Health, we did a systematic review comparing the modalities, and we managed to gather 79 articles comparing phone and video. And what we found was that 50% of the studies indicated that video was the most effective modality. That was not a surprise for us, but at the same time, it was good to see that the research also showed that. Only 4% of the studies have shown that the phone was the most effective one, and 35% said that both modalities were equally effective. And then when we look at the clinical outcomes, video was better than, if not equal to phone. And video was also the more cost effective, despite having a higher incremental cost than the phone. So when we look at factors that these studies brought that promote video over phone, the studies show that the visual assessment, it's important. It assists with diagnosis and the management of a specific condition. So when you need to look at wounds or decide to transfer a patient from primary care to specialist care to hospital, the verbal and non-verbal cues that people are able to assess, healthcare professionals are able to assess over the video, for example, for mental health assessment. If verbal communication with the patient is not possible, the visual cues are also important, and especially when the patient prefer, video. These were the reasons why clinicians have decided to adopt video consultations over phone. But then when we get back to the Australian numbers, we were like, but why people use phone more than the video then? This is research that we did right at the beginning of the pandemic, and we interviewed pharmacists at a metropolitan hospital, and we asked them the questions, why do you prefer to use phone rather than video? And what people said to us is that, clinicians, they recognize the potential benefits of video consults. Some of them even said that they recognize that video is superior, but they had a lot of challenges in implementing that modality of care into their administrative and workflows. And a lot of the time they thought, or they perceived, that patients were unable to use the technology. They sometimes assumed that patients were unable to use the technology. And they believed that in person was better care, and the telephone was easier. Of course, it's easier to pick up the phone and call someone. It's way easier than to book a video appointment. but it is acknowledged as well that clinicians acknowledge as well that video was had potential more benefits to patients. So then we went on and we did a whole lot of research around healthcare consumers and telehealth and digital health to see what do consumers think about this? What do they prefer? Why do they use? Why do they not use? And when we dig deeper, between what is available and what is used, one of the subjective dimensions of this use or adoption is trust. So we know that if people don't trust, they're not going to use it. And we found that trusting telephone consultations, when we compared the two modalities, phone and video, we found that trusting in telephone consultations are significantly higher than trusting video consultations. We also saw that confidence in use telephone consultation is significantly higher than using for video. And then we found an association as well between the experience with telephone consultation and trust and the experience with video consultation and trust. So that means that if people are experiencing more telephone consultations, they will trust more telephone consultations. And if they experience more video consultations, they will trust more video consultations. So then we went on and we went to ask them, instead of just surveying, we went to actually have a proper qualitative interviews, and we explore a little bit deeper, how can we improve this? How can we improve consumer trust? How can we make people trust better, digital health modalities? And a lot of people talk, and we had in the media in the last few weeks a lot of news on data breaches and data sharing and concerns around data sharing. So we asked people, if they actually are concerned about sharing their data. And what consumers said to us is that they express more concern about sharing identity data than health data. And they actually they have more worries when there is fragmented information. So the clinicians do not communicate the information between themselves. So it's actually not true that people are worried about sharing data. They are worrying about sharing the identity data. They are worried about ID fraud, but they're not worried about if people know that they have diabetes, they have HIV, or they have any other disease. That's not what they are concerned about. And we also ask our consumers, what is telehealth for you? And people said around half of the people that we interviewed for this study, particularly we interviewed only 25 people, but half of them said that telehealth was talking to the doctor on the phone. So that was the awareness that they had. And of course, that is the experiences that most consumers had with telehealth. And then we went to dig a little bit deeper and we went to check, what does influence consumers' trust and why is it trust so important? Because people talk about trust, on the media a lot. So we went and we actually saw that there are a lot of factors that are positive associated to trust. So if people have more digital literacy, they're going to trust more. If they have high income, education, if they are satisfied with that interaction, they're going to trust more. The better experience they have, the better they trust, the better the quality, the better the trust. So there's a lot of factors that we can actually improve to improve consumers' trust. But we also found that if people trust, they will use more, they will adopt more, they will find it useful, they will accept, and they will be willing to share the data more. What we found as well was that if they perceive there is a risk or if there are any privacy concerns, that will negatively impact the trust that they have. This study has been recently published in NPG, which is a Nature journal, and it's been, quite revealing the results that we found. And we also found that trust is a very complex, concept, and it needs to be break down a little bit more in order for us to understand what influences trust and how can we improve. But we did try from all these studies that I showed to you, bring some of the results. and list some of them. So how can we increase, consumers' trust in telehealth in order for them to have better experiences and use more? So we need to be mindful that the quality of the telehealth experiences that they have and providing better experiences will actually make them trust more. And it's easy to remember, remember the first time you had a video appointment? If that was a bit traumatic, probably the second time you went to try that, you were like, oh my God, I don't want to do this again. So having positive experiences really impacts trust. Promote the digital literacy and awareness of telehealth benefits is also something important for people to trust more. Promote video consultation so people will have more experiences, will also promote trust in this modality. Have more transparency in where the data is going to go, what is the data collected for, and how that data is going to be managed is also important for people to trust. Having an established relationship with the healthcare professionals, we found that if people trust the healthcare professional, if that healthcare professional recommends or prescribe a digital health intervention, is very likely that the consumer will transfer that trust from the healthcare professional to the digital healthcare modality. So it's important to have that relationship already established with the healthcare professional. We need to increase the quality of the telehealth encounters. As I said, it's related to the experience, but we also need to give consumers a choice. We need to ask them what they want. And we definitely need to have better interoperability and integrated care. We need to share more the healthcare data, and we need to be more across what people need. And I say we because I'm also a clinician, so I take the blame as well. And here we have an infographic that we did for culturally and linguistic diverse patients. It is a way of increasing awareness of clinicians, instead of assuming that your patient is not capable of using telehealth, just ask. Ask if they are able to do it, because most of the time they have already done a Zoom call, they have called the grandkids, using their phones, they have seen a video, they have done it before. So ask if they had the experience, ask if they need some help, if someone can help, and maybe train that consumer. We have found more and more that there is a role for someone to provide that support to the patient while they're doing the telehealth appointment. And that can be a family member or can be a healthcare professional as well. So to wrap up, I know I have gone over my time, apologies, but what I want to really leave you with the message is that video is the most effective telehealth modality compared to the phone. It's important to get ready for your telehealth appointment. And again, positive experiences will influence your feelings and your attitudes towards this modality in the future, whether you are a clinician or a healthcare or consumer, just try to make that experience as best as you can for yourself, because that will influence how you feel in the future about it. Try not to assume, ask what is the best modality, try to give consumers a voice and a choice for what they want. And let me know if you have any questions. Thank you very much for this opportunity. I leave there my contact details in case you want to get in touch. And again, appreciate the opportunity to be here. Thank you.